Imagine this. You're at home enjoying dinner with your family when you glance around the table and you notice your uncle suddenly has a painful and terrified look in his eyes. He grabs his chest and moments later falls to the floor unconscious. Would you know how to handle the situation while everyone else around you is panicking? Would you know that your uncle was probably suffering from a heart attack and needed cardiopulmonary resuscitation or CPR? As a lifeguard, I was required to become certified in CPR, so I have been certified for 4 years. In an emergency such as this, it is not your job to treat the illness, but you are to keep the victim alive until trained medical professionals can come and take over for you. Tonight, I want to explain to you the life-saving process of surveying an emergency, contacting an emergency medical service, and starting CPR if needed. Let's start with the first step of surveying an emergency. According to the American Red Cross, the first step in any emergency is to survey the scene. The most important thing to remember in administering first aid is to make sure you and the victim are safe. You don't want to put yourself or the victim in any more danger. If it is safe to proceed and the victim is not moving, check the victim for responsiveness. Call the victim's name if you know it. Shake him or her and ask if he or she is okay. Then call for help. Now that you have checked out the scene and know the victim is unconscious, the second step in any emergency is to contact an emergency medical service. An emergency medical service can be any number of contacts. If the service is offered in your area, call 911. But if 911 isn't offered in your town, call the hospital or the police directly. And if you do not have those numbers, you can always call the operator and he or she will contact you with the correct officials right away. Designate one person to contact EMS. If there is no one around, you must call the emergency medical service yourself. Give them your name, address, the victim's name, condition, and the aid being given. It's particularly important to remember to let the dispatcher hang up first so you know that he or she has no more questions and an ambulance can be sent right away. After the EMS has been called, return to the victim. First, position the victim. Move the victim in the correct position, trying to keep the person's body as stable as possible, protecting the head and the back in case there has been any injury to the backbone or to the spinal cord. Position yourself next to the victim's shoulders. Then check the ABCs. Open the airway, check the breathing, and check the circulation or the pulse. First, open the airway. Take the hand that's closest to the victim's head and put it on their forehead. Next, take 2 fingers of the other hand and put it on the bony part of their chin. Tilt back. Next, check for breathing. Look, listen, and feel for the breath. Look for the chest rising and falling. Listen for the breath in your ear and feel the breath on your cheek. Do that for about 5 seconds. If there is no breathing, you must give 2 full breaths right away. Take 2 fingers of the hand that's on the victim's forehead and pinch the nose shut. Then take your mouth and seal the victim's mouth, giving 2 full breaths so that no air escapes while you're trying to breathe. Then check the circulation or check the pulse. Take 2 fingers and put it on the center of the victim's throat and slide it into the groove that's next to the throat. Do this for about 5 seconds. And if there is no pulse, chest compressions must be started right away. First, position your hands on the victim's chest. Take 2 fingers of the hand that's closest to the victim's feet and slide it up the bottom of the rib cage till you reach the notch that is directly beneath the breastbone. Then, take your other hand and place it right next to your 2 fingers. Weave your fingers inside your other hand. According to the American Red Cross, while keeping the correct hand position, straighten your arms and lock your elbows so that your shoulders are directly over your hands. While in this position, enough pressure will be created to compress the chest 1.5 to 2 inches for an adult. Do this 15 times counting out loud. 1 and 2 and 3 and 4 and 5 and 6 and. Continue the cycles of breathing and compressions 4 times. After the 4th time, check the victim's pulse again. And if there is still no pulse, continue these cycles until the victim breathes again or until trained medical professionals arrive and can take over for you. In conclusion, this short speech was to show you the importance of surveying an emergency, contacting an emergency medical service, and starting CPR. If you take the course, you will learn more about the details of taking CPR. Now, let's go back to the emergency in the beginning of my speech. Because of your knowledge of the 3 steps in administering CPR, you can be that vital link in an emergency, and you can help save a life.